Hello and welcome to the QMobile Patient Queue demonstration. Over the next 10 minutes, I'll take you through a quick demonstration of how Patient Queue can increase patient satisfaction, increase patient throughput, and staff satisfaction. Patient Queue uses an interactive SMS technology designed to increase interaction with your patients. Patients can receive a text message which will notify them that it's their turn to see the physician or practitioner, and also have the option to reply key commands back to the queue system. For instance, reply T for more time, L to leave a queue, or S for a status. These are optional features that you can turn on or off depending on your needs. So let's get started. Patient Queue is a web-hosted solution. In other words, there's no software or special hardware that's required. It simply loads up in your browser. Through a secured password, your staff will be able to log in and manage multiple queues or a single queue at the same time. Patient Queue's user interface is what you see here. We have our Help button, which has a tutorial, as well as a support information, the Queue Manager screen, a kiosk if you decide to deploy a self-serve kiosk. Right now, our kiosk is designed to render with iPads, which is a lower cost kiosk option. And patients will enter their name and their cell phone number and choose the queue that they want to be entered into. And that then will show up into one of the queues down here that we've set up. Very simple. And then our reports. We have 5 reports. Customer list report, which will show all the customers by date that were in the queue. Customer scene report, which is really important, which identifies customers that actually have been seen, served and seen by a practitioner. Customer left report are customers that were entered into the queue, but for whatever reason were not seen. And how we track that is by, if staff clicks this red button, that would identify the customer never did see the physician. Or if you use our interactive technology and the customer replies L to leave the queue, they would be recorded on this report. The goal, of course, is to have more customers seen than customers left, particularly for satisfaction and revenue reasons. Then we have a customer in queue report, which will enable you to run a report by date by practitioner to determine the volume of customers. This is important for enhancing efficiencies, obviously workload and revenue issues. And then our average wait time report. So this way we can see if some of the process improvements you might make will reduce the wait time. You also have 2 other reports that you can let us know that you want, and we'll provide those as well. Okay, so it's pretty straightforward. We set up our queues. So we have Dr. Bob, no one's in his queue. We have Dr. Green, we have 2 people in his queue right now waiting, and then imaging. Now you can simply have one queue and use one queue to and have one queue to manage all your practitioners if you choose to. I just wanted to show you how you have multiple queues. So Dr. Bob's staff would just log on, and he would, or Dr. Green in this case, would be able to see just his patients. But he's also able to check out what's going on in imaging. And that's important because, for example, if Dr. Green sees Emma Munson, and right here we put her in for hip revision follow-up, he would click serve. This would notify Emma that she needs to come and see Dr. Green. Once Dr. Green is through with seeing Emma, he would click serve, so she is recorded as a patient that has been seen. Now before he does that, he may decide that Emma needs to go in for a follow-up x-ray. So he can look down here and say, well, Emma, if you'd like to make an appointment for an x-ray, or today we can get you in. It's only a 23-minute wait, and there's 3 people in front of you, 3 patients in front of you. In that case, Emma says, no, I'd like to get an x-ray today. Dr. Green can then move Emma by clicking the imaging button, and that will then put Emma into the imaging queue so she can get her x-ray. The staff in imaging will see her be added, and will notice a note that it says hip revision. So that's a really neat feature. So that's what's nice about having, multiple departments or practitioners breaking up the queue so you can move patients back and forth. Okay. So now let's I'm going to add myself into the queue. I'm already in the queue here, so let me remove myself from the queue, for example. So in this case, to serve me, we click serve. And then, okay, if you heard that, that was the message notifying me that I'm being called to the imaging queue. And the message that I programmed says, thank you for choosing the West Phoenix Clinic. You are next for imaging. So I get that message. I then respond to staff and come up to be served, to see the physician. And then once that occurs, staff will click served. And that removes me from the queue, but it records me as being seen. Okay, so now I've been seen. And let's go up here. So let's put somebody in the queue. We can add an ID, or we can have the system generate a 4-digit ID. And that may be a good case if you use our digital display technology for those folks who don't have a cell phone. So in that case, you'd have this projected up onto, a monitor in your waiting room. And folks that choose not to get a text message can look here to see where they are in the queue. It shows the first 3 people. It also has a feature where you can have digital display advertising refresh in between the queues, which is a nice feature. So in other words, you can use an ID, or we can program it so it generates an ID rather than projecting the name up in here. So Mario Peoples might be code 3434 or what have you for HIPAA reasons. Okay. Then we add in the cell number. And then we can add a memo, which is important, so we know perhaps we can communicate what the issue is. Injured left hand. And Bob's our hand guy, so we can tap or click. Now we're putting, so in this case, you hear Maria's going into the queue. It's my cell number. So right now I'm getting the messages, which state, thank you, here it is. Welcome to the core clinic. You are number 1 for Dr. Bob. You will get a text message when it's your turn. Reply L to leave or S for more time. So we have those 2 interactive features that Maria can do if she chooses to. She can check her status in the queue later by replying S, or she can leave the queue by replying L. So Maria's in the queue. Let's add somebody else. Do this real quick. Like I said, you don't need phone numbers to put them in the queue. Obviously, it works better if we do, but they'll be on the digital display. So if we go up to our digital display, you'll see Mario Peoples, Leo, and Emma Munson are in the display here. And then we have Maria Munson here and Kevin Curry. Refresh this. Now we see Mark. Okay, in this case, I want to show you a feature that's really cool. So say we serve Maria. We click serve. This is going to send her a text notification. There it is. The text notification is going to say, thank you for choosing West Phoenix Clinic. You are next to see Dr. Bob. And this button, this number shows that we've texted her once, and the last time that we've texted her was at 6:20. And so we wait for her to respond. Now, if she doesn't respond, but for whatever reason we feel she's still in the area in terms of the clinic, we can either remove her from the queue or we can use the move back. And this is a nice feature because rather than totally taking her out of the queue, we can bounce her back so we can then go ahead and serve Mark while we're waiting for her. So that's a handy feature. Now say we decide to serve Mark. And now we realize, well, maybe Mark needs x-rays. So we can click on this. Typically you need a phone number. And here we can put in hit save. And now we have Mark in here. We put a note, Dr. Bob wants them to x-ray his left knee. And so we can put him in the imaging queue. and there's Mark in the imaging queue. So that's about as simple or as complicated as it gets. Folks go into the queue, click serve. That will notify them that it's their turn to be served. Once they do respond, we then click served in terms of past tense, which records them as being seen, removes them from the queue. Or as I mentioned before, the other option is we can click served. In this case, if we want to, rather than remove them from the queue and record them as being seen, you have the option to move them to see another practitioner. You also have the option to add a note or edit a note to communicate to the other practitioner. In this case, we'll just finish serving. And also our move back feature. As I mentioned before, if we serve Mario, Mario isn't responding for whatever reason, we can click move back and it will move him back 4 positions in the queue, buy him some time. And in that case, we can move on to Leo. We're recording the time they were entered in the queue, the average wait time for each queue. And then the last thing I want to show you is the ability to hit SMS all. So you can also click this to send an SMS to everybody in that queue. For instance, if it's getting late and it's time to close the clinic, and you're not really sure where everybody is, you can send this broadcast message, which is really neat. And lastly, let me show you what a report looks like. So customer scene report, which we think is the most important. We would click on our date fields that we want to see information on. Report will show up, customer scene, and it'll be by doctor and by date. And then you can click export, and that will export it into Excel for further analysis if you'd like. And that's how our queue management system works, patient queue. Very effective and very easy to learn. Look forward to hearing your feedback. Thank you.